So welcome everyone, thank you very much. Just to introduce everything on the admin front, the meeting is being recorded and will be published afterwards on our website. So if anyone doesn't want to be seen, please remove your video. If you wish to engage in conversation, could you please use the chat facility? And if you know how to use this, if you go into open the participants in the bottom left-hand corner, there's the raise hand option. And if you go to the normal reactions box, there's plenty of opportunity to clap at all occurrences. Thank you. So at this stage, oh yes, everyone will be on mute, please, so we don't get any background noise. But as I say, if you do want to say anything, please either type something in the chat or raise a hand. At which stage I will hand over to Councillor Massey, who, as per our governance as a city councillor, is the chair of the AGM. And as people will also know, he also is our Essex County Councillor and is a town councillor, and at the moment the Deputy Mayor.
And I'm pleased to welcome the Mayor, Morrow, here this evening. Just some more admin. The exits, fire exits are at the front of the cabin, the rear of the cabin, and over the wings, just in case. There are no fire drills planned, so if there is a fire alarm, it's for real, and you can follow me out. Welcome. It's nice to be here. I think this is the third or fourth time I've done this part of the meeting, although it's usually in the Trinity Church. Do we have any apologies, Nikki?
We do. Lorraine Jarvis, Jill Ragg, Carol Laker, Janet Tipping, Claire Hall, and Val Carter, although they might join us. Okay,
thank you. And I think we have the introductions. I think most people know who most people are. If you have to speak later on or you wish to speak later on, I'm sure you can introduce yourself. So item 2 is to accept and approve the minutes of the 2020 AGM and public meeting held on the 8th of July as an accurate record. I trust you've all had a look at those. Is everybody happy that we can accept those? I will assume assent unless I hear otherwise. Silence implies assent. Those have been passed. Thank you. And item 3, to receive the annual report of the Health and Social Care Group for 2021 and appendices at those hyperlinks that you've got. Again, I will, if you've got any comments, please raise a hand. Otherwise, silence implies assent. Thank you. Moving on. Appointment of officers. Surprise, surprise. Once again, the only nominations for officers are Peter as the chairman, David Birch as the task force chair, Jackie Birch as the minutes secretary, and the officers in turn appoint Nikki as the administrator if they are, of course, elected. Peter was nominated by Jill Ragg and seconded by Sheila Smith, and David Birch and Jackie were nominated by Valerie Howard and seconded by Penny Weller. Given that they're all the only nominations, is everybody agreed that they should be accepted as the officers for the coming year? A couple of nods there. Raise a hand. Let's see you're still awake. Thank you very much. Okay, moving on. Peter, you are back in the chair and I will mute.
Sorry, you do have to also take the proposed amendments to the terms.
Oh, do I? Okay, item 5 then. I have to consider and approve the proposed amendments to the group terms of reference. Did you want to say anything to that, Peter?
All I need to say is that we've tidied it up, and hopefully everyone has seen that the changes are really just to bring us up to date with where things are. And I don't think there's anything in there which is controversial, but I'm happy to explain should anyone have any points they wish to raise.
Any questions from anybody? Okay, once again, silence implies assent. All those in favour, those against, make a noise. Lisa, you okay with that? That was, that's in favour, thank you. Just checking. Okay, there you go, Peter, all yours now.
Okay, thank you very much indeed. Nikki, perhaps we can share some of the slides later after we've had Dan's session, and I'll say which ones. So thank you very much, Bob, for helping us through the logistics. Much appreciated, and thank you everyone for your support. So I'd like to introduce, unfortunately, Mac Anthony McKeever has had a late unexpected event and can't be with us, but Dan will cover what he was going to say and all the topics. So Dan, if I can introduce you, you are the Alliance Director for Mid-Essex Clinical Commissioning Group. Mac told me you've just been made his deputy. Does that give you a title as well?
Deputy Accountable Officer, yeah, to Mac.
All right.
That was
recent, well, congratulations. I said that I wasn't going to be too complimentary because I didn't wish your head to swell, but he was saying that you are doing an excellent job as the Alliance Director and really forging what that new role is all about. So that's very good for us to hear. So Dan, if I can ask you, what we really would like to know about is the present situation of the NHS, particularly as it affects and runs in South Woodham, what's likely to happen in the coming months under the present systems, and there is a government white paper about the future of the NHS. We wonder what that might mean for us. And of course, it's all in the context of the pandemic situation, which we're still facing. And just so that people know, today's figures for South Woodham Ferrers were that we now have 73 cases in the week ended the 10th of July, which was an increase of a lot, 875%, and that's the highest we've had for the town since the week ending the 17th of January. Over to you, Dan.
Yeah, I'll do my best, Peter. I'm not good on Zoom because we use Teams, so I'm going to do my best to share my screen. I'm also got two computers going, so this is my home laptop. I've got my work laptop next to me in case I need any further information. But tell me, is this screen shared so far? That's
a beautiful photo of Mac with his mouth open. I like that. That's a good one. You caught him there nicely.
He recorded a message for you, Peter, and asked me to play it. So I've tried my best. I don't know whether this is even going to work, but I'll try it. So this is from Mac. So hopefully you guys can hear this. I can see Bob and Peter and John Cormack in my screen. So if you can hear this, wave at me at least so I know that it's doing something. So I'll press play and we'll see what happens.
Unfortunately, we haven't got any volume. You need to turn the volume up on your. That's it. Up.
Can you hear it? Did you hear it at all, or?
Very, very quietly.
It might not work then. Let's just try this again. But if it doesn't work, it's not the end of the world. He did try. No.
We can't hear it well enough.
No, never mind.
Take it as read.
Forget it. He basically says he's very sorry that he can't join you this evening. He really wanted to be there. I think he said something along the lines of he believes it's your 20th anniversary or something like that. So congratulations on that. He said that I've told him about all the good work that you guys have done in South Woodham Ferrers and continue to do. And he's delighted to sort of hear that. And he's desperate to come and visit you guys in person at some point. And when it's appropriate to do so, he'd like to come out and be able to see some of the stuff that you're doing firsthand. So that's essentially what he said, Peter. But I'll send you a copy of the video and you can maybe attach it to one of your emails that go out or something so people can watch it anyway. So I'll try and make this discursive, okay, guys. I don't want to sort of talk at you the whole evening, and I have got a few slides that I'll put up in a minute that hopefully might guide some of the conversation later on. But originally, Mac and I were going to split this between Mac giving you an update on the kind of the strategic direction of the NHS, and then I was going to speak a little bit more about local issues. But now I'm going to do both. So. I mean, Peter said it, and some of you will be aware of this, but the NHS is going through one of its standard sort of slightly sort of hidden reorganisations that it tends to go through once every 5 or 6 years. And I've now been in the NHS long enough that this is probably my 5th or 6th one of these. JC, who's on the call, who I can see, has probably been through more than that and has probably seen about 15 or 16 of them. They happen. The ambition is always good. It's always to improve things. In some cases it does, in some cases, you know, I don't think it does. In this case, I think the intentions are right. So Peter said there was a white paper that was drawn up, and it was drawn up in advance of the COVID pandemic under Matt Hancock. And the fundamental ambition of the white paper seemed to be to break down some of the artificial barriers that have been created in the NHS over the last couple of decades, actually. And those barriers exist, for example, between social care and the NHS. I'm a physiotherapist. Some of you know that. My wife's a physiotherapist. If my wife goes into somebody's home in the community and makes a decision that they need a walking aid or that they need some stair rails on, quite often she can't do that if that person's a social care patient because they're known to social care. So she needs to call on a social care physio or OT to go and make exactly the same decision, and vice versa. It's bonkers. Many of you will know and will have experienced this either yourselves or via relatives, where this artificial division between health services and social care services just creates problems. It creates handoffs. It means patients have to tell their stories lots of times. So part of the ambition of this white paper was to break down that barrier. And then one of the other barriers that's been created, and this has happened during my time in the NHS, is what they sort of called the sort of purchaser provider split. And it was where, when I first started in the NHS, I started off in London and then in Maidstone in Kent. And we kind of all just worked for the same organisation. So as a physio, I worked for the same organisation as the hospital, as did everyone. And then over a period of time, they started sort of breaking it up, and they introduced these things called PCGs, PCTs. And then they started creating community organisations that did community services. So for a time here, we had a thing called KEC, Central Essex Community Services, that subsequently became Provide. We had a mental health provider that then became EPUT. We had a hospital provider that became MEHT, but is now MSE. Generally always 5, 6, 7 letter acronyms as well that just confuse people. But the general gist for patients is they don't recognise that. They kind of, you know, who are you seeing? I'm seeing the NHS physio or the NHS OT. It's not the Provide one, the EPUT one, the NELF one, the NEC one, the God knows however many other acronyms are. So the idea of that was to break down some of this as well. So there was a suggestion, the white paper was paused because of the pandemic. And then as things started to ease, there was an announcement that the white paper was going to progress. And the fundamental thing that it suggests is it's going to abolish CCGs. So the organisation I currently work for, Mid-Essex CCG, will be abolished as of April 2022. It won't exist. Neither will any of the other CCGs in our area. That includes Basildon and Brentwood, Southend, Thurrock, Castle Point and Rochford CCG, and potentially North East Essex and West Essex CCG. And in its place, they're going to create a thing called an integrated care system. And I suppose the idea is in the name, integrated everything together, care, not just health, care in general. So it's not just about people who are unwell, it's about people who need and care in general, and then system, it's the whole system together. There was a suggestion the white paper was going to be paused. It's fair to say that the existing Secretary of State at the time, Matt Hancock, found himself in some bother, and then a new Secretary of State came in, and at that point there was a suggestion it would pause. Our understanding is the Prime Minister himself didn't want the pause to take place and wanted it to happen, and we were told in the last couple of weeks, and indeed the white paper received its second reading in Parliament last week, that this is going to happen. So from April 2022, there'll be no CCGs. There'll just be this thing called the Mid and South Essex Integrated Care System. It could quite possibly be the Essex Integrated Care System, where bits that have been chopped off previously, North East Essex, which is Colchester and Tendring, Clacton, Harwich, that area, West Essex, which is Harlow, will also be bundled back in the mix. And the whole thing will become an Essex health and care system. It will include the NHS, all of the different organisations, hospitals, GPs, dentists, optometrists, mental health providers, community service providers. Everybody will be in that integrated health system, as will local authorities, which in our case, for Bob, you know, is Essex County Council. but is also Southend and Thurrock being part of it as unitaries. And the idea is that we work together to try not only to break down some of those barriers that I spoke about earlier, but also to start to understand that the health of our population is a combination of multiple factors, and actually the quality of your healthcare services, whilst very, very important, actually only play a relatively small part in the overall health and well-being of the population. So clearly, if you're sick, then the quality of your GPs and your hospital services is very, very important. But actually, in keeping you well overall, there's far more important factors that exist within our society, including things like the quality of people's education, whether people have meaningful employment, good jobs, the quality of people's housing, the quality of people's environment, their access to leisure facilities, all of those things. And it's a combination of all of those factors that ultimately contribute to people's overall health and well-being. And you see that. And you see that when we look at Thurrock, our most deprived ward, and see that the rate of lung cancer is vastly in excess of what it is in other areas. When we look at places like Tendring and Jaywick and Clacton, and see that the incidence of certain types of cancer are far, far greater than they are in other parts of the world. But it also doesn't mean that places like where we are in mid-Essex are immune from that. We have pockets of deprivation. We certainly do in Chelmsford, in Malden, and in Braintree. And we also have pockets of ill health that are created through other forms of lifestyle choice. And the classic that we see these days are people who are actually relatively well off, but maybe drink too much because that's how they cope with their job, or maybe are overly stressed because of work and those sorts of things. So there's multiple factors, and the idea is that we work together to address those. So that's the fundamental principle of this reorganisation. Most of you who know me know that I tend to speak pretty honestly, and I'll say to you, I'm always a bit cynical of these reorganisations. I've been through several of them. This one does feel a bit different. It does feel like there's a bit of a different focus, and that it's moving away from the standard money saving kind of chopping and salami slicing, just trying to get everyone to work harder for less money. It seems a bit different to that. It does seem that there's a willingness to work collaboratively. But clearly, you guys will be the judge in 4 or 5 years' time as to whether we are making a difference. I have a role. I have a few other roles I do. I'm a school governor, a chair of governors of a primary school in Malden. I sit on a board of an organisation called Active Essex, which promotes physical activity in Essex. I was looking for my Active Essex hat, but I don't know where it is. And it's through those organisations that I really do see the value. I often sit as a school governor frustrated, thinking, why are we not doing more to help our children at the moment? Why are we not helping our children's mental health, which is suffering because of the impact of lockdown? Why are we not encouraging our children to be more active at school? Likewise, with my Active Essex hat, you look at the barriers to people taking part and making healthy lifestyle choices. It really isn't easy. It really isn't easy for some people. South Woodham, you're blessed with quite a diverse kind of area. But if you go to somewhere like Melbourne, in Chelmsford, which is one of our most deprived wards, there's a surgery there called Parkside Surgery, run by Dr. Booth Junior. Now, it used to be Dr. Booth Senior. You would know, John. You go along the little parade of shops there. You can't buy a healthy meal. You simply can't. There's a chip shop. There's some other fast food sort of kebab shop, pizza place, and then there's another shop that only sells. Malden Prom, where I live, is pretty similar. Some of you must know Malden Prom and must have been there. It's very difficult to buy anything other than chips. That's what it trades on, and actually that influences the well-being of the population that use that. So it's only that when we work collaboratively with that we can start to do things. And actually, what I would say, and I'm not saying this because you're this audience, I'm saying this because you are a good example of it. Actually, you have all the ingredients to do some of this good stuff in South Woodham. You've got a council that Bob and that Peter constantly remind is a council that's not just for the city of Chelmsford, but is for the villages as well, for South Woodham and Danbury. And they are a council who I believe understand this agenda. They do want to do more. They want to work collaboratively. You've got a group of GPs that are, that are good GPs. They perform well, and I'll talk to you a bit more about that in a moment. But again, they've got some ambition. They want to do more. They want to develop services. And you've got yourselves, you've got a community of people. There aren't, you know, I get your South Woodham Ferrers newsletter that Pete sends me by email. I've been out to Trinity Church, God knows how many times over the years. You've got a community of people that take a really active interest in the well-being of your population. And believe me, that doesn't happen everywhere. I don't go to meetings like this in every single one of our towns and districts. There are some. I'm not saying that you're entirely unique, but actually you don't see this level of engagement from such a diverse set of representatives of a particular town in everywhere we go. So actually you've got a lot of ingredients to do some really good things. The job that I have, Peter referred to this thing called the Alliance. So whilst CCGs went away, the idea is that this ICS can do things at a scale of about 2.2 million people in Essex. The idea is that the ICS can start to make some decisions for the best interests of those 2.2 million people and make them much more quickly and easily than they would have done historically. And so historically, if we wanted to make a decision about major trauma services, something you've heard Peter talk about, we had to go through 7 different CCG boards. And if the answer was we need one major trauma centre or one burn centre, and people say, why do you need one burn centre? It's because the equipment, the expertise, the specialism, you can't replicate it. It has to be concentrated in one place. And you'd say to all those 7 CCG boards of doctors and elected members and all this stuff, you know, we need one burn centre or we need one major trauma centre. And everyone say, yeah, we get that. It makes perfect sense. So long as it's in Southend, or Thurrock would say, so long as it's in Basildon and Mid-Essex, so long as it's in Chelmsford. And then we'd sort of argue amongst ourselves. The idea now is that some of that gets taken to a bigger level where the decision's made for the best interests of the population. But the potential there is that you lose that local focus. So within the ICS, they create these things called alliances. And they're, I suppose, little micro versions of an ICS. So the alliance in Mid-Essex involves our district councils, or our city council, in your case in Chelmsford, but Malden District Council, Braintree District Council, involves the local branch of the police, Farley Hospice, who's our end-of-life provider, provide people will do our kind of community services, mental health providers, Virgin Bernardos, who run our children's mental health services, representatives from county council, but at a more local level. So people who are really only interested in Malden, Braintree, Chelmsford, and those sorts of things. And the idea there is that we work together to solve some of the issues that challenge our populations that are maybe a little bit more unique to our particular area. And I'll give you one example of what one of those that I think is very real and pertinent, and then I'll stop and you can ask any questions before I move on to the next bit. So the example I think that I'm trying to get the Alliance to take ownership of is suicide in our communities. In Malden, in Chelmsford, in Braintree, all 3 districts have a higher suicide rate than the national average. And it's not a blip. It's been higher than the national average for about 7 or 8 consecutive years in all 3 districts. It is in Essex generally. Malden was particularly high. And it was Malden and the Dengie. And I appreciate South Woodham's in Chelmsford, but the proximity, you understand why it's a sensible example. The male suicide rate in Malden, particularly for men of my age, working age men in their sort of 40s and 50s, is 50% above the national average. Men in Malden at the moment are 50% more likely to commit suicide than they are somewhere else. You know, I'm raising 2 boys in Malden, and I hear that, and I'm horrified by it. And I think, why? You know, why? And there's lots of hypotheses, and I'm sure you'll have ideas as to why. But what I'm saying to the Alliance is no one organisation can solve that. That's not down to GPs. It's not, you know, it's not down to GPs. It's not down to the NHS. It's not down to the police. It's not down to the district council. It's not down to the county council. It's not down to the British Transport Police or whatever. It's so multifaceted that every single one of those organisations has to take an active interest in reducing that to do something. And you look at parts of the world, the best example they give you in the research is Detroit in America, where when Detroit lost its car industry, there were just so many families that were just devastated through a loss of industry. The suicide rate went off the scale and they had to do something about it. And they took this multi-agency approach where they said, everyone has to make this their issue. And you start doing things and people say, what can we do? Well, you know, it's been a little while. It's probably only been about 8 weeks since I've walked around South Woodham. But you think about barbers. You've got plenty of barbers in South Woodham. You can train the barbers in mental health first aid. You can train them in suicide awareness. You can train the publicans. You can speak to schools. You can educate children. You can educate staff. Clearly, the GPs have a fundamental role. But actually, you've got to work with your businesses as well to understand that if you are going to see a big decline in a particular industry through COVID, which we're going to see at the moment, when loads of people have been furloughed or have lost their work or lost their industries, pubs that have closed. Think of communities. Think of some of the little villages, you know, the Prince of Wales or something like that. What that does in your area. Imagine that closes because of COVID. How many people lose their connection to their place? And so the point I'm trying to make is only through everybody working together collaboratively on those things that you can address some of those problems that no organisation can address on their own. And suicide's a particularly poignant example, but there are other examples that exist as well. So we're going through the process of this all happening at the moment. I won't lie to you, it's stressful. Everyone gets told their jobs are at risk. We'll have to go through processes, but the job at the hand stays there. We've still got a job to do in front of us now more than ever. I'll stop at that point and take any questions around that particular bit, Peter, and then maybe move on to some of the other stuff afterwards. But anything anyone wants to ask, or any observations, any comments, anything particular? Go on, John. Good. You're on mute, John. I'm good to see you because I haven't seen you for ages. But
yeah, I very much like the idea of your interest in general health and the fact that so many organisations and so forth have to be involved. It's not just a sort of healthcare professionals domain. And I think that's something that we need to look into here, because we, according to the neighbourhood plan, in which health hardly features at all, we have a problem with obesity and hypertension in South Woodham greater than surrounding areas.
Yeah.
And so that seems to be something that we could concentrate on. And it's interesting because where do you start? You maybe go to the schools, you maybe try to approach the supermarkets. They all have to be involved, because no one is going to start preaching to customers, because it might push them away. But if they're all involved, and you might make progress. So I think that's probably something we should think about and come up with some proposals.
John, where I'd signpost you to for that is the Colne Valley, Freshwells, GP called Dr. David Oliver, and I'll send you the web link. I'll put it in the chat in a moment. But Freshwells as a primary care network, but it works for South Woodham as well, set up what essentially was a low carb project. So try and encourage certain patients for a low carb diet. Yep. And there's evidence that low carb can help with obesity, but they were specifically looking at diabetics, also people with things like polycystic ovary disease, that type of stuff. Freshwells as a GP surgery set an ambition that the patients that registered on this would lose a combined metric ton in weight. So 1 ton, all the people that registered on the programme. And they, you know, like those, when you're trying to get a new roof for the church hall, you do like a thermometer or something like that. They did that in the surgery to show like how much weight people were losing. And the thing that was amazing about it, and still is amazing, they've extended it out to more surgeries now, and the target's gone up to 2 tons, is that a lot of those people not only lost weight, they went into diabetic remission, so they stopped taking insulin or diabetic medication, and in essence, they were no longer diabetic. They say remission because they could go back. But the most amazing thing was it became a community project. So they started creating menus, and then they did get cafes on board that started to say, if you're part of this diet, say, because we've got something that meets the criteria, I don't know the exact nature of it. They did start going to schools. And the most amazing thing, and like I say, I'll put the website link in a minute, was the stories, because what it ultimately meant was not that, I mean, it's great that people became, you know, the people went into diabetic remission, but what you actually see is people saying things like, you know, I can now play with my grandchildren. I can now do this. I can dance again, or I can do my gardening. All these things that they were struggling to do. So the human story is actually the bit that catches people. But you know, you're right, John, and that's where, you know, it's great that you know that information. It's great that you know that. But that is the concept of of what these little hyper-local things can do, is pick things like that and say, actually, let's come together and let's try and do something about it. And if nothing else, you just try, don't you? I mean, if it doesn't work, you try something different. But
there's some things you can't change. I mean, you talked about the sort of environment in Malden where there's fast food outlet after fast food outlet, and we have the same problem here. They've just opened a KFC drive-through, which is probably the last thing that South Woodham needed. But you know, we are where we are. But there are other things that can be changed. So yeah.
And Chelmsford City Council, a good example. Peter will know this, Bob may know this, but they put an accreditation in, and I'm going to say something that you will roll your eyes out at the minute. But when new houses are built, I know nobody wants new houses, but where new houses do get built, Chelmsford introduced essentially a healthy initiative into their planning applications, and it was simple things to just say, you know, what about this new development encourages health and well-being, not just people to be fit. It's not all about putting a gym in. People don't always want to be fit in a gym. What does it do to encourage just general health and well-being? So even simple things. Does it have a nice garden that encourages people to go outside in? You know, is it well lit? Do people feel safe in it? How many new developments and have dingy, quiet corners where kids go and can be a bit antisocial, that kind of thing? Does it encourage? And they started to assess developments on that. And that's a small thing. It's not going to change the world at all. It's not going to change the world. But if it makes people feel safer, it gives people an environment to be outside. It maybe encourages people on walking routes to signpost them into some of the nicer areas around the town, those sorts of things. It has a good walking connection to things like shops. Then people are more inclined to walk. Simple, you know? So there are things you can do, but equally, granted, you know, when you get planning for KFCs and things, there's only so much you can do, but it's doing what you can. And like I say, you've got a secondary school in your town, that you've got a leisure centre, all of which are assets that can help. You've got, you know, wonderful sort of park facilities around. So there's a lot that you have got that can tackle that. And if they can do it in the Colne Valley, I'm absolutely certain you could do it in South Woodham.
Sure.
Just to say a couple of things, Dan. It's actually 22 years, because it was this group was originally a millennium.
It was for 2000, wasn't it? I do know that.
We must thank John, because he was the one who got it going, because he recognised that South Woodham as a new town was being shortchanged with its healthcare facilities. So it was 1999. And just on the suicide front, which I absolutely agree with, interestingly, there were a couple of very high-profile suicides in a few years ago, as a result of which Bob and others got mental health first aid training done in volume here. So there is a very good base for that. Personally, I'm extremely pleased that there's this new mental health support group that has been given to William de Ferrer's school, because I think that the professional support in that place is really going to be helpful, and I'm looking forward to seeing how that develops. And the Prince of Wales did a fantastic job, as probably John knows, because it's his local, and Bob also, because he was one of the volunteers there amongst some of our volunteers. They kept going, delivering meals to people in the community throughout, and did a fantastic. I know exactly what they did, Peter. One of our staff, Irene Lucy, volunteers there as well. Some of you might know she's one of your residents. But it's a perfect. Can I just say,
Bob? If I can just briefly interrupt. Never mind the past tense. The Prince of Wales is still delivering every week.
Yeah. I guess the point I was trying to illustrate.
Well, I also just want to add, you mentioned myself here. We've also got Murrah, who's the town mayor. We've also got Jackie Birch, who's a town councillor, and Lisa Kelly, who's a town councillor. So there is considerable engagement in the town and interest in this. We've also got Linda Denton present, who's one of the school pastors, helping with the well-being of the kids at the school. And let's go off piste a little bit, because loneliness hits people of all generations. And Murrah, God bless him, over in the corner of when I'm seeing him,
I can
has
see him, yeah.
set up a community radio station and broadcasts every Sunday evening from 5 till 8, a request show that is crowdfunded for people just to get in touch with each other. And there's a Facebook page and everybody pings one another and so on. I dip in occasionally, but most of the people that listen to that are in their 30s or 40s. So the music's too heavy for me. But it's there.
Yeah.
I also wanted to rewind very briefly. You mentioned the new development that's proposed north of Burnham Road. If you look at the plan, and I'll be corrected if I have to be, Countryside have actually said that that is the least dense development they have on their books, and it has more green space and more footpaths than anything they've ever developed. So you're up in the hills, you're close to Radar Hill, you're close to the walks out to Stowe Maries, where I understand there's quite a nice pub that does very good food.
Yeah.
As well as easy access to the Fen by the KFC roundabout and the walks along the river. So the opportunities are there, the open space is there. You know, hopefully we're not building a new ghetto.
No, Bob, that's a really good example.
But all of that stuff is baked in.
Yeah.
I think that's the key.
Yeah.
And I'll shut up now because it's not my show.
No, I think it's a brilliant example, and it is that point of making those points. They sound like little changes, but they do make a big difference. They do make a big difference. The point I was making about the Prince of Wales, and I appreciate mercifully this isn't the case in South Woodham, but there are parts that we've got, you know, in the Dengie, in Goldhanger, where pubs that had that type of role. That, you know, it's more than a pub, isn't it? It's far more than a pub. It does comedy nights, it serves meals, it made face masks, it did all of those things. The Bell in Purley, some of you may know, is very, very similar. They're hubs of the community. If they go, my point is the impact that has on that community. You know, people pitch up to their GP then because they're lonely, because they're lost, because they're isolated. Everything that you've just said there, Bob, it makes a difference. It does.
Well, I am going to blow my own trumpet very briefly. That one of the guys I delivered to on the Malden run for Rob at the Prince, when the first or second time I was delivering, he says, "Oh yeah, you're doing a really good job, you boys. Somebody told me that he's even got a mare delivering." I said, "Yeah, that'll be me." He says, "Oh, well, excuse me if I don't kneel down, I might not get up again."
It's a great example. It's a great example. Now, again, in the interest of trying to keep this as more of a dialogue, I'll share my screen again. Let me just check. Tell me, does this come up? Does it come up?
Yep.
I put a couple of pictures. I've got some facts and figures. It won't go onto slideshow on my screen. So, Peter, do you recognise that picture? The kind of what looks like an auditorium or something?
Give us a clue.
It's the University of Warwick, Peter. It's my God. It's their some new building or something like that. And I put that there as a reminder because I'm going to tell you about some of the things that are happening and have happened and will happen locally. And rather than put sort of boring PowerPoints, I thought I'd just put a few pictures. So the University of Warwick's important. Why is it important? Because Peter went there. But other than that, it's also important because Peter's connected us to the University of Warwick to do a little bit of research with some students. And the research that we want to do is about sort of citizen involvement in healthcare decision making. I'm really keen, and that, you know, in part that's why I'm talking to you guys tonight. I'm really keen that anything that our alliance does is led by what our people want to happen. So John's saying, you know, we've got an issue with obesity, diabetes in South Woodham Ferrers. You know, that's what we should be focusing on. That's what we need to support you on. You know, almost forget what the NHS targets say. If NHS targets say it's this, that, or the other, actually, the town have identified, the data shows this is what we want to focus on. Citizen involvement is hugely important. So Peter's engineered a scenario where we can work with the University of Warwick, not just for South Woodham, for the whole area, but to show how powerful citizen involvement in health decision making can be. And I've set the challenge to our alliance to say our alliance needs to be delivering on behalf of its citizens, and in order to do that, it needs to be communicating with its citizens in a different way to what we've done historically. Now, this is great, but it's not enough. I need to make sure that staff, not just from the NHS, from all the organisations of the Alliance, are getting out there and talking to their citizens as much as possible to hear. I'll go through the other pictures first, and then we have a conversation again. The second picture, which is the person with an injection. Some of you will recognise that. Peter will, because he's had one. John will, because he's done one. Others will. I will, because I've done them. That's somebody giving what I would guess is a corticosteroid injection into a knee joint. Tends to be done for arthritic knee pain. In the days when I first started off as a physio in South Woodham, actually, in the clinic, physios weren't allowed to do those injections. Not all GPs did those injections. In fact, very few GPs did them. So if you needed one of those injections, you generally had to go to the hospital, at least to St Peter's, quite often to Broomfield. Over the years, more and more physios have been educated to do those. The GPs in South Woodham Ferrers, the primary care network in South Woodham Ferrers in Crouch Vale Medical Centre, are on the cusp of appointing what we refer to as a first contact physio practitioner. This isn't your typical physio where you go in and get your back manipulated or get your muscles kind of worked on or whatever like that. This is a physio, this is the type of role that I did when I was at St Peter's in South Woodham, where you take on extended skills. You can prescribe medication, you can inject joints with steroid injections like that. In some cases, you do it with an ultrasound machine. You actually scan the joint and inject. And you can do all of that in a place like Crouch Vale. And you're going to get one of those I believe they're interviewing pretty soon at the moment. And what Michelle Phillips, one of our staff, asked me to tell you guys is to work with your practice, and I think Maya might be on in the background, to make sure that the public understand that this isn't a typical physio. These are extended roles to help the GPs. And what you'll start to see is that if you go to the GP surgery and somebody says to you, can I ask why you're coming along? And you say, because it's my arthritic knees playing up, that you might no longer get booked with the GP straight off. You might get booked with this individual. This individual, he or her, whoever it turns out to be, not only can they manage your problem, they can send you for the x-rays if you need x-rays, or the MRI scan if you need it. They can give you the injection if they need it. They can prescribe if you need it. They can do all of those things. What that does is it deburdens the GP and allows the GP to focus on the more complex long-term conditions, people with multiple problems that need much more of that GP skill to do it. Now, of course, if the first contact physio is struggling and they're finding the diagnosis difficult, of course they can go in and call upon their GP colleague and have a conversation with the GP, and vice versa. And you're going to see more of these roles popping up in GPs, in part. And the cynical people have said, you know, it's just because there's not enough GPs. There's some truth to that. We are struggling with GP numbers in the UK at the minute. Many of them are choosing to go and work in you know, Australia and Canada and places like that. So we are struggling with GP numbers. But at the same time, that then leads to common sense saying, well, if we have got this precious resource of GPs, let's reserve them for the things that they're best at and that only they can do. And some of the stuff that actually they don't need to do, let's see if we can get other people to do that. Similarly, for mental health, there'll be mental health workers, and you'll also have these people called social prescribers, which I know you've already had for a while, and you know about those. But they're people then who will connect people to community assets, where actually somebody who does go in and actually does want to do a little bit of volunteer work or something, because that will, they've had a discussion and that may help them out, then that can happen. So you're gonna see those things there as well. I put a picture of the 15-minute waiting area of the Crouch Vale Medical Centre in, to just say thanks for the amazing work that you've done in terms of volunteering. And the Crouch Vale picture with the people, and I don't know whether any of you are in that, some of you no doubt are, it's a bit small for me to see. Again, I took from Dr. Mystery Surgery's webpage, where it said, thanks to our amazing volunteers for making this happen. What you've achieved is phenomenal. It's absolutely phenomenal. What I'm going to ask, it kind of pains me to ask, but we're going to have to do it again. And you know that we're going to have to do it again. Peter told you about the COVID rates coming. We know that they're going to increase. We've been told in the NHS to prepare for peaks at the back end of August into September. We know that people are going to keep getting pushed into social isolation and 10 days of isolation. No doubt many of you will have had it of family members, school children, etc., etc. The volunteer ask is not diminished at this present time. And likewise, we know that the NHS is going to be asked to deliver booster vaccinations in the autumn as well. concurrently with flu jabs. And we're told that this year, because flu last year didn't hit the NHS, flu didn't hit us at all last year. Why? Because we were all locked down and we were all wearing masks and we weren't socialising in large groups. Now we've got our freedom back. Not only does that increase the risk of COVID, but flu, which has devastated the NHS several years in the past, certainly 2018, we were hit so hard in this region by the flu, that will be back. So we've got to deliver the flu jab, we've got to deliver the COVID jab, we've got to look after folk who are going to be isolating. And back to my original point and almost the theme of this meeting, we can't do that on our own. The GPs can't do it on their own, and you know that because you're all in those photos. But the ask is still there, Peter. What Peter asked me yesterday, and I tried my best to get it for tonight, was the modelling of the impact. How bad is flu going to be? How bad is COVID going to be in this region? We haven't finalised the modelling yet, Peter, but I sent an email today to say I need that modelling to be shared with me, even if it's on a really high level, because, and I'm possibly oversimplifying it, but I can do maths, you know. So, you know, if these are the numbers they're modelling on for 2 million people, well, you divide it down and we get down to the kind of 20,000 in Southwood and Ferrers, and we make some estimates of the number of people that you're going to see that are in, you know, in problems because of COVID or flu. And I'll hand those over to you guys, because I know then that you can start to plan a little bit what you've already done and what you did so successfully in lockdowns 1, 2 and 3, because we are going to have to step up and do it again. And like I say, it saddens me to say it, but it's naive to think that it isn't going to be a really, really, really tough winter. And actually at the minute, our GPs are exhausted. They've all been flogging themselves. Very few of them have taken leave. And if I give you the example of Dr. Anna Davey, our chair at the moment, she's currently isolating for 10 days because her husband, who's exactly the same age as me and doubly vaccinated, has contracted COVID and is pretty unwell. So the vaccine works in terms of reducing hospitalisation and reducing the likelihood, but people who are double vaccinated are getting COVID and they are becoming ill, people in their 40s. So, you know, I see your, like I say, I look at your email that comes around and you're unique, you are unique in giving town COVID rates. I don't know any other town in our area that does that. I would urge you to watch them and be sensible. And, you know, it's not for me to talk about the kind of the political side of you know, the easing of lockdown restrictions, but I know that our GP surgeries are really hoping that people continue to be sensible, continue to wear masks, continue to keep their distance, continue to wash their hands, all the things that people have done, because they know that if they don't, that it's going to have an impact on everyone. So sorry that that's a slightly sort of morbid point, but it's a really important point to get across to you, and I know that you guys will get that out to the community. So any questions on any of that aspect of what I've said?
I mean, it's more than just flu and COVID. They're talking about respiratory syncytial virus as well.
Of course, yeah.
On this winter, and that's going to be tough.
And John, the other thing is there are you know, I won't say where and who, but a GP told me the other day about 4, all male actually this time, all of whom were in mental health crisis, all of whom needed to be referred to quite severe mental health services, none of whom had previously been diagnosed with any kind of mental health problem in their medical history. So the impact of the previous 18 months on people is profound in many, many ways. The organisation that I also work with, Active Essex, are promoting this campaign called Find Your Active at the moment. And it's this question of how many people have been as active as they historically would have over the last 18 months. I haven't, because I sit on screens like this for 12 hours a day. People have been scared, they've been isolated, they've been shielding. So even that dog walk that they might have normally done, that walk to the shops, their sport has all been cancelled, all of those things. And the impact of that on long-term condition management. John was talking about diabetes and hypertension. Actually, one of the best things you can do for your diabetes and hypertension is keep active, but people haven't been able to keep active for the last 18 months. So we are in for a difficult time, and I'm not going to water it down. It's going to be difficult, and we will be speaking to people, to people on this call, Peter and others of you, to say this is where you guys are able to help, and you did it brilliantly. But we're going to ask it of you again.
You talked about GPs being fatigued, burnt out and so forth because they've been working continuously through this. I mean, in South Woodham, as elsewhere, there's a lot of people saying, oh, isn't it terrible? You can never see a doctor, you know, there's no face-to-face consultations, whatever. On the other hand, the BMA and the RCGP and people like that are saying, well, actually, if you look at the figures, GPs are busier than ever. They're seeing more patients than ever. And on top of that, they've got all these other burdens. They've got, you know, the vaccine rollout and so forth to deal with. They've got to prepare for this winter onslaught. But it doesn't seem that the two sides can see each other's point of view. So maybe there's scope in South Woodham for some sort of discussion.
John,
Sorry, John. I don't know whether you know, we deep dive into that when there was quite a surge of comments about it. And I don't know whether you saw it, but we actually looked into that very closely in conjunction with the GPs at Crouch Vale, and have a report which is on our homepage all the time, which explains the measures that our GPs have taken to improve their communications capability in various ways, and also shows that it is a partnership. And unfortunately, a lot of people have been clogging up the phones with calls that really weren't necessary or appropriate and could have been answered by using email. And we keep pushing that message out to explain to people the best way of making communication, of getting contact. So I would urge you to have a look at that. And as I said,
I'm aware of that. When these things come up on Facebook, I usually step in, and it's often the receptionists, of course, who get it in the neck, because that's the worst job in the practice, because they're in the firing line from the clinicians who are busy and can't see any more patients, and they're in the firing line from the people who phone up and say they've got to be seen today because they're really sick. So I do that on a sort of day-to-day basis, but it still seems to be the case that there is this not failure to meet in the middle, and it may be.
John, you're right. You're right, and you sort of teed me up a little bit, because I figured you guys would ask this, and again, you're quite unique in having done what Peter just described. But this is GP demand. This goes back to April 2020. GPs over the last this actually goes up to May, but it continues now into July. Demand is now the highest that it's ever been since I've worked in mid-Essex, and I started in mid-Essex in 2004, and it's the highest that it's ever been. If you follow that chart back, and if you look at those numbers there, tracking around 3,000 or 4,000 appointments per day, they're now tracking up around 6,000 appointments per day. And then people say, oh, but GP surgeries are empty, they're not seen face to face. Hold on, my slides change. This is a graph, you probably won't be able to see it in great detail, apologies, but this is a graph of the distribution around face-to-face. And on average, you know, this point here is the midpoint. It's about 50-50. So throughout the pandemic, this goes right through the kind of pandemic phase, January look to March, when we were in lockdown. GPs were seeing about 50% of the appointments that they were seeing, you know, face-to-face. And I've ringed some of your surgeries as Greenwood, Kingsway, and they're only plus or minus a few percent. There are a few down here that are outliers, but they're not in this area. So the vast majority of your GPs in this area have been seeing either 60-40 or 40-60 face-to-face. The reality is that waiting rooms aren't full. And the reality is that people aren't going walk-ins, and that's because the GPs have been told nationally still to triage everybody on the phone. The final graph I put in, again, to just demonstrate and bust a few myths, is people always say, everyone's calling 111 because they can't get into the GPs. Actually, this is a graph of the number of appointments that GPs offer versus this is the number of appointments going up, and this is the number of 111 calls going up. And what it actually shows is the GPs, as a rule, the more appointments the practice offers, the more 111 demand it is, not the opposite way around. The practices that overuse 111, none of those are in South Woodham, are ones called Church Lane, North Chelmsford, Sutherland Lodge and Silver End. They're actually all of our Virgin Run practices, which suggests to me that perhaps patients are not as satisfied with the Virgin Run practices as perhaps they are these other practices. But your GPs in South Woodham have been engaged throughout the pandemic, continue to be so, continue to actively take part in the kind of the primary care network process that's happening at the moment. But I think you're both right in saying that they're challenged at the moment. They are. Surgeries weren't designed with total telephone triage in mind, and trying to get, you know, BT to add extra lines into surgeries during a pandemic. Am I still there yet? I thought I'd frozen for a second. It's really difficult. But, you know, in the recent, you can look it up online, the recent patient satisfaction survey that came out, South Woodham Ferrers does pretty well. And I think that is in part in partnership between yourselves and the surgeries and the work that you do. But generally speaking, your residents seem to be pretty satisfied with the services that they're getting from GPs. That isn't the case everywhere in Mid-Essex. I'll certainly say that. But that's not to say that there isn't more we can do. And of course there is. And John, you know, when you comment on social media, things like that, it's really powerful. It's meaningless when Mid-Essex CCG comment. Nobody bothers. But you know, when you guys speak locally, and Peter, that work that you did in terms of busting some of those myths, it's hugely powerful and hugely helpful. And I suspect the GP surgeries are really, really grateful for it. And again, not in the case in South Woodham, but John made the point about the receptionists. And the more we can do to help them, the better. We've had receptionists in our area who've had their tyres slashed. We've had receptionists who've been spat at and told that they've been spat at by people with COVID. That's unacceptable. I don't care what people are feeling. And I know people have wound up, and I know everybody's in a difficult position at the moment, but to spit at a receptionist is unforgivable, really. That hasn't happened.
Copy of that report in and handed it over the desk to the receptionists. And when they were pretty grateful.
I'm sure they would be, Peter, but bear that in mind. Like I say, a lot of them they haven't had the time off. I know we all haven't, but you know, it's been pretty full on for the last sort of 18 months or so in the NHS, like everyone. And so, yeah, I think it's great work, Peter, and I only wish more of our kind of neighbourhoods would do that type of thing, because it's brilliant, and I'm sure they appreciate it. Anyone got any other questions, Peter? There wasn't anything else I was going to cover unless there's any specifics. I'm happy to stay after anything. I know you've got other things on the agenda, but anything people want to ask? Anything people want to comment on? Or
what people are thinking, Dan?
Yeah.
What I'd say is that I think that what you've come out with and what we know is that social media is no more representative on this than on so many other things. Whilst it's important that we do address the myths and the misinformation and the fake news that comes up on it, because it does spread as Chinese whispers, it's not necessarily representative. And interestingly, when you talk about our town's GPs, our dentists, our opticians, our pharmacies, generally speaking, I mean, nobody's perfect. But none of them get out of bed in the morning meaning to do anything wrong. I think that there's a very good level of service generally. And certainly, I mean, we're going out literally every day. I mean, we've delivered now, how many? I've written it down somewhere. 7,679 activities since the 23rd of March 2020. So we're seeing people on the doorstep every day. And generally, you know, you get the odd little thing, you know, the odd bit with the meds not being quite right, etc. But generally speaking, particularly the clinically extremely vulnerable people and the people who are having to isolate because of COVID, etc., they generally do feel supported. And I think, as you rightly said, it's a great community effort. And we do well in it.
Yeah, and I certainly, I know if Matt were here, he would say just how grateful we all are. Certainly, I know that I know a few people who live in South Woodham, and they're hugely proud of the effort that you guys have put in. So, yeah. Anything else anyone wants to ask, or or add or challenge or
what you've said about the changes, what you said about the changes within the NHS does allow for that horrible word, a vision, to maybe have some sort of cohesive plan for the future, which involves raising the sights a little bit from what we all do every day. So I think that's something we should. I'll put something in writing and send it to you and see if you think it's crap or if it's
and I'll connect you up to give you some examples of like the diabetes work and stuff that's going on as well. So like I say, you've got all the ingredients to make it work. So sorry, wrong.
I think, Dan,
anything from anyone else?
The concept of pulling things together, of integrated working, is commendable, and takes us back to where the NHS started. The difficulty, as you rightly pointed out to a certain extent, is that these days you can't have every bit of the NHS on your own doorstep. And in fact, my experience with the major trauma scheme, we're saving far more lives because we've got a regional major trauma scheme, and the recovery of the quality of recovery of people who go through that is so much better. But you do have to travel to Addenbrooke's or to one of the trauma centres for that, because you want that concentration of the expertise and experience to give the best outcomes, which you can't get if you go to the community hospital at Malden. And that's no disrespect. It's
complete. It's 100% right.
Yeah. So bringing everything back together, but it's a very complex organisation, health and social care, it's our interest is obviously smooth patient pathways, smooth user pathways. But inevitably, it's a complex organisation that's trying to put together. Bob.
Yeah, briefly, with my county councillor hat on, which is the one with the gold braid on the top. I actually sit on the Health Overview Scrutiny Committee, and I've been sort of aware that this was coming for some time, and we've had briefings from various people at various levels. And unusually, having done 4 years on Health Overview, this is being viewed with less suspicion than anything else I've seen in sort of the health service for some time. The cross boundary internally is actually being welcomed, I think, and so let's hope that it's a step in the right direction.
Yeah, and I think the thing I understand from Essex, and I completely get it, Bob, is it would make sense if we could be Essex again rather than having this sort of artificial, because I know that when you speak to Councillor Spence and others, if you're Mike Doherty, Director of Public Health, some of you know.
Now, would that be the Mike Doherty that's stranded in Majorca on holiday?
Yeah. But Mike Doherty, as things currently stand, has to interact with 3 of these ICSs. One for the north of Essex, one for the west of Essex, and one for the middle part of Essex, which you can see why that's just would be driving him mad. So we're hoping to hear about the boundary for this thing in the next kind of 10 days or so. So, and in our case, we've always worked well with North East Essex, so that certainly could be a good thing. And Peter, you're absolutely right. And the example I often give to people is the Burn Centre in St Andrews. Not only does that serve Chelmsford, Malden and Braintree, not only does it serve the east of England, it serves the south of England as well. And do you guys remember a couple of years ago, there was a horrific nightclub fire in, I think it was Bulgaria or Romania, somewhere like that. It was a nightclub fire and lots of people were really badly burned. Those people were flown from Bulgaria to Brize Norton, RAF Brize Norton, and then taken to the Burn Centre at St Andrews. So we have a specialist centre there that not only is the best in our region, the best in the south of England, but even for big parts of Northern Europe, patients come to that centre. And people understand that you can't have one of them in every hospital because there aren't enough experts. There's world-leading experts in that unit. And it's the same even with stroke, as Peter said, or major trauma. You simply cannot have one of those in the St Peterses and the Braintrees of this world, because the guys that man it are so expert and they're so few and far between. The equipment that they use needs, you know, not only does it cost, the cleaning, the power even to power some of it, the infrastructure that you need for all of that has to be super specialists. And you know, I would urge any of you, and some of you I'm sure will know people who have experienced this, but if you look at the outcomes for myocardial infarction, STEMI and NSTEMI in our area, and I know Peter and John will know this, but actually, you know, in our area, since we've had the cardiothoracic unit in Basildon, you're far more likely to survive a heart attack than you were before it was there. Even if you had the heart attack just up the road from Broomfield Hospital, nowadays you might drive past Broomfield or Southend to go to the cardiothoracic unit, but when you get there, the care that you get keeps you alive, and our outcomes are so much better. And Peter made the point about major trauma with Adam Brooks. You know,
We got
exactly the same. They take one. Yeah. Who's got the hand up?
Janet, you'll need to unmute yourself, please.
Hi.
I see you, Janet.
Comment. There's a hi, Dan.
Hi, yeah, good to see you.
Yeah. I want to make a comment as a carer. I look after my mum, who is 96. I'm a retired health professional, so very aware of working jointly with all the agencies and sort of keeping her at home by the sort of things that I do with her. But I would just say the changes that have been made in the practice over the last 12 months have made my life as a carer so much more difficult, even in terms of prescriptions. I do have online access for her, but when the practice sort of merged, that obviously was very difficult, and we still haven't got it back properly. Everything just seems to make life more difficult, and I just think sometimes things happen, changes happen, but actually I feel that my life as a carer has got so much more difficult over the last year. And sometimes.
And is some of that because of lockdown, Janet, or is it? It's a both, or
administrative changes in the practice.
Yeah.
I think I will actually maybe challenge the practice manager on some things, but it's not just because of COVID. It's just little things that think, oh, that's a good idea, we'll do that. But I feel I can access a health professional, that my access to a health professional for mum is so much more difficult than it was. And I don't mind a phone call sometimes, a phone call's fine. But if she's really, I want to speak to someone, I'm keeping her at home. She hasn't been in hospital other than for cancer and hip knee replacements. Because I'm really proactive. The minute something's going wrong, I sort it out. But actually, that's getting harder because access is getting more and more difficult. And I just wanted to highlight that. Lots of things, they seem like great ideas, but I feel my access has actually become so much more difficult.
So the only thing I'd say, Janet, is that almost takes me back to the point that I said to Peter, where I want our alliances and our networks to listen to people, and don't give us the detail of why now. There's no need, but what I'd like to think is we could get you into a dialogue with the people that can listen to what you're saying, and where they can make changes to make it easier. Then I'm sure that they will. I know that several of our surgeries, not just for recognising carers or the people that the person being cared for, or the carer themselves. Same for people with learning disabilities, same for people with dementia. We're not as good as we could be. So we need to try and get someone that can affect the change to listen to you. And
I'll just give one very simple example.
Yeah.
Back in May, she wasn't well. I thought she probably had a chest infection. It was a Saturday. I rang 111. In the end, we had an ambulance came out, paramedics. We got taken to A&E. We were there for 6 hours, and she came home. Really, all we needed was an out-of-hours GP appointment. And I just think the amount of money it costs to go in an ambulance to Broomfield, be in a cubicle for 6 hours. And you just think sometimes it's all, we're going in the wrong direction sometimes. So that's an example. But yeah, I would really like to actually put it from a carer, but also as a health professional, for both sides. I think would be very useful to know how I can make my voice heard.
So I put my email in the chat, Janet. Drop me an email. You know me anyway, but and we can facilitate that. Same for anyone on the call. But John's got his hand up. Might want to say something.
Thank you.
One thing we used to do was I used to give people email address, so the emails came through to me. And because I don't get out much, I used to pick them up at weekends and so forth. And the other thing, which I guess the practices could do if they combine together, is to have a mobile phone and have a list of patients who need particular care and attention. I had a mobile phone, which I gave the number to people, for example, terminal patients who might think at the weekend. And if you knew the patient and their history, you could deal with it in a minute. Whereas, as you say, if you're dealing with people who've never seen that patient before, then you end, going by ambulance to Broomfield and sitting there for 6 hours, and it's
almost like a hotline.
Very far forward. Sorry, we were saying, Dan, were you saying something?
No, I said almost like a hot. It's almost like a hotline, isn't it? To say
Yes.
only patients that are really in need can access the direct line. Yeah,
They
good
could
idea.
write that up. I mean, you could have a list that the receptionists have, so that they know which patients need particular care and it needs to be acted on quickly. So maybe your PPG, your patients participation group, could liaise with the practice and see if something like that could be set up so that you have a more satisfactory relationship.
Sorry, that sounds very much like the old system that we used to have, where there was a rota for the GPs to be on call for weekends and things, isn't it? And certainly, that sort of level of customer service, patient service, unfortunately, is something of the past. And of course, the 111 service is meant to be the alternative for that, and I think we'd all agree that it's not as satisfactory as the old one was.
It wasn't. I wasn't on call for every patient every night and every weekend. It was just those patients who particularly needed someone that they knew and who knew them and who could deal with things quickly and easily. And that worked pretty well, but it's not. I take your point. If I was nearing retirement by that time, so I'd known people a long time and all that, and it's not something I would have done when I was a young GP, and it's not something I would expect young GPs to do these days because they all have family commitments and so forth. But I would have thought some sort of rota whereby that sort of system could be there in the background might be possible.
Yeah, I think the important thing for me out of that is to make sure, that people like Janet get the opportunity to have that dialogue, because that may be the solution. John, Janet may have some other ideas, and that's kind of what I'm saying is we need to make sure that people can be listened to. So drop me an email, Janet, and we'll see what we can do. But
any other questions for Dan? No. Okay, well, Dan, thank you very much indeed for covering those points. I think the conclusion seems to be, or one of them, that integrated ICSs, integrated care systems are coming, and generally the principle seems to be welcome because you are aware of the need that we also have localism. And to be fair, people like me and others on the community engagement summits that you've held on a regular basis are equally keen to make sure that locality is still very much part of it. And I think if there's one lesson from COVID, it's that bottom up has worked and top down hasn't, particularly when it comes to the community and voluntary support, because we know our places. And when people set up a vaccination hub and they're doing it from Oxfordshire, they're not quite as aware of the road system and the need to where to put the signposts as we are locally.
And
To
Peter,
use my example.
and Peter, you know that I mean this, but and I'm not just saying it. If you guys ever want me to come out as the restrictions ease to speak to a particular group, I'll certainly endeavour to do it. You want to do another thing? It doesn't have to be an AGM, just a specific session. Let me know, and I'll certainly endeavour to try and do it. Happy to come out and see you daytime or evening, providing I can get someone to look after the hoodlums. But, yeah.
Well, as you know, we're already on commission to continue working and supporting the community through the pandemic, through till the end of March next year.
Yeah.
Peter, you got a hand up from Murrah as well.
Oh, right, sorry. Murrah.
Thank you, Mr. Chairman. Yeah, I'd just like to kind of reinforce what you said there, Peter, and to Dan, that, you know, please try and ensure that when these ICSs are like up and running, that they don't get like stuck at the county and borough council levels, because, you know, you can see here the power of the parish level and how it works, and it delivers the specifics, which makes us different from, say, even someone like Munden just up the road.
Yeah.
So, you know, and I do get nervousness when these, you know, these new orbs re-engage. They tend to start at the top. They start at Essex County Council. What do you want? Then they move to the boroughs. You've already mentioned them: Braintree, Malden, Chelmsford, and you'll get all these so-called experts at that level, and the parishes get blocked, and the input doesn't get there. So I'd just like to reinforce that observation. We're fortunate here that we have a very powerful social care group under Peter, that, you know, the fact that you're here is credit to that. But, you know, we do get nervous if things can start to get blocked and you don't actually hear it at the local level.
Murrah, I couldn't agree more. You know, it comes down to knowing, like Peter said, it's knowing the streets, it's knowing the shops, it's knowing the areas. I 100% agree with what I'm saying to my team at the moment. These PCNs, these primary care networks, and your one is sort of works in parallel. You've got one that's a sort of the Dengie, one that's South Woodham. I've said to my staff, you know, that's the level that you need to be focusing on. That is, there are some things, granted, that are county, some things, but I 100% agree with you, and I will certainly do what's in my power to ensure that that is the case. And if you don't think it's the case, you know, call me up on it, by all means.
Thank you. And Murrah, just to say that there is a thing called Live Well Chelmsford, where I'm fortunate to be on there to represent the town, and Dan's on that, and he will confirm that I'm forever banging on about South Woodham. In fact, Lorraine Jarvis from the CVS gets upset if I don't. But there is a strong voice on that for the villages, the surrounds, and that it's not just the city of Chelmsford, it's the whole area. And that's very well, it's a good group. And also the summits, the community summits that the CCG or the Alliance is putting on a regular basis is a real opportunity. And the one we had yesterday was a good example of that, I think, Dan.
Yeah. But I completely agree with Murrah in terms of the point.
Okay, thank you very much, Dan.
I'll leave you to it then, Peter. Thank you, and apologies again for Mac, but hopefully that at least was reasonably helpful for you guys. But my contact number's in the chat, or contact number, email address. Please, any of you want to say anything, just drop me a line. Not a problem.
Thank you very much.
Thank you very much.
See you all later. Bye-bye.
All the best. Nikki, are you still there?
I am, yes.
Oh, good. Oh, that's all right. It's okay. You'll be hiding behind our logo. Could you be very kind and stick up the slide with the stats on it, if you know which one I'm talking about? No, but we've seen them. Thank you. Right. Okay. The next item is activities. Just to let you know, we had to do detailed stats for the month of March, and it's in the annual report, but I'm so grateful for a number of things. For our previous administrator, Emma Wardle, who in the autumn and early winter of 2019 set up our new website and all our social media capability. And then Nikki, who's come along and is so instrumental in getting all the information out. We get information from all sources, national, regional, local, and we do sift it and then publish what we think is appropriate and relevant to the local people. So today, for instance, there was a very good Public Health England blog about alcoholism, and equally we get the weekly notifiable diseases things, and some things we publish and something we don't because we don't think it's relevant, but I suspect we probably publish more than enough, but we do our best to filter it and make sure we put out what's relevant to parts of our community. And the other people I want to say thank you to is to our group of volunteers who stepped up and who are helping to get out every day to continue to deliver the prescription meds and the welfare to the people of the town and the surrounds, and who will continue. We're as busy now and as we have been throughout this, and we're prepared and ready to continue that. So would anyone, thank you. I think probably the best thing is to put that slide away now. Thank you, Nikki, so we can see everyone. Does anyone wish to make any comments or ask any questions about what's gone on during the last year? No. Yes, Mara.
Yeah, I'd just like to, on behalf of the town council, really thank you all. I mean, I just did a quick tally of your figures, 7,000 since March the 23rd, and what it is, that's over 15 deliveries a day, every day, non-stop. So, on behalf of the town council, I'd just like to say thank you for the effort of the volunteers, and we do notice it, we do appreciate it, and I will be writing next week because it's my turn to do the focus talk again, and I will be, sharing those thanks as well, and trying to keep the town motivated to all the things that I've heard here today.
Thank you very much. And I mean, we've helped out with things like the testing at William de Ferrers, with the vaccination hub centre at Tyler's Ride. You've had the volunteers from the patient participation groups who've been doing all the support to the amazing number of vaccinations that have been done at Crouch Vale Medical Centre for not just the town, but the whole of the PCN area. So people really have stepped up. All I'd say is inevitably people are getting back into more what you might call normal activities at the moment. It's getting harder to find volunteers for things, but the need for volunteers continues. So we will all continue doing all that's necessary. And
I think Peter, Mara was actually being quite modest in saying thank you on behalf of the town council. Mara, as town mayor, of course, is the first citizen of the town. And so he's actually speaking on behalf of all the residents as well as the town council.
Sorry, thank you, Mr. Mayor, much appreciated. Thank you for putting me right, Mr. Deputy Mayor. I think what Dan said's right. It's the strength of the community as a whole. And I think that is really, really helpful. And there's so much good effort and good heart in the town. Okay, the next item on the agenda is what should the relationship of our group be with a private provider? Now, as you may have all seen, the old health clinic in Merchant Street, I don't really want to debate the issue. We didn't like it, but it was given up by the NHS and they said they would never use it. So they put it up for auction and somebody bought it. And we've now found out that it looks as though it's going to be a private provider of various services. And there's a question, what relationship does the town think? It's rather difficult because it hasn't opened. Originally, it looked as though it was going to open at the beginning of July and now it's been delayed. So we haven't actually seen much of the detail and you can't find out much about it. But the question really is what relationship in terms of patient and public engagement should we have with private providers? I mean, we do obviously have people who go to some of the private hospitals for various things because the NHS uses them for such things, and certainly they've been used. I mean, a lot of people will have been to Springfield Hospital for procedures in the last year which were NHS procedures. If anyone has it yet, Bob, you're muted.
I also did a virtual hand.
Sorry.
What I would suggest, it's very early days. I think where we go from here is we don't exclude them. We work with them if we can. There's a parable somewhere about it's better to be inside the tent than outside. I can't remember the details of it. But if we don't engage with them, then that's potential opportunities lost.
Yeah, I think we explore and see where we get to. Murray, your hand's up.
Yeah, I'd like to kind of just, agree with that. And also, I can talk very quickly. When I was working in London, I had, going back 5 or 10 years, 8 years ago, I had very, very good private cover, and I used to travel a lot. And I used the private services that were at Springfield, the private GP services. And, I didn't use them because I didn't like the NHS. I used them because I didn't want to burden the NHS. I was in there within a day. I told them I was travelling to Botswana and staying in a tent. Within a week, I'd had my rabies injections and all the other injections done. Yes, it costed me money. Yes, I could have got them through the GP surgeries, but I would have still had to pay. Yes, I was still referred to Greenwood for the yellow fever vaccination because they said they couldn't do it. But the whole thing was, for me, it only used the NHS where it had to be used. So, let's not exclude this. South Woodham is not a poor town. And there are a lot of people that do have private cover. And, it can be a route to, ease burden. And I think we should, as Bob says, we don't have to openly welcome and get, fully engaged from day one, but we shouldn't have an exclusion mentality either.
Do we know which company has taken this over?
No, not clearly. I mean, it says Essex Medicentre or and if you Google it, all you get at the moment is basic premises related information. Originally, it said it was going to open on the 1st of July, and then when it didn't, it now says the 26th of July. So.
Very sad.
I think that we wait and see more about it when we can. It's difficult to talk about it. We were hoping, obviously, that we'd know more by now, and some people have raised the issue. So,
what provision is going to be made for all those people who depended on the health centre and the surgeries around the health centre, the medical hub of South Woodham, which was ringed by accommodation for the elderly, who find it difficult to get to the periphery? There was talk at one time of setting up a nurse in the town centre. Did that come to anything?
Right. I think the first thing is that whilst there were a lot of concerns expressed before the change happened, there have been relatively few since, a lot less. That's just a matter of fact, a report. The town nurse project, sadly, has been hit by the difficulties of COVID. We did try to recruit someone on a 1 day a week basis round about this time last year, but unfortunately there weren't any nurses available because everyone was tied up delivering vaccinations. And it's equally difficult at the moment. Plus, of course, the necessary training courses have had to be suspended. So it's still on our agenda, but unfortunately, if I was being asked to predict, I would say it's unlikely we'll be able to do much in terms of delivery before at the earliest next summer.
Okay, there was, I think, £70,000 put up by the developer for a minibus to help people get to the Crouch Vale Centre. Do you know what happened to that? Did that just disappear?
Yes. No, it was used ultimately to help to go towards the cost of the circular town bus, because that has the way of reducing and of lowering and hiring and that sort of stuff to enable it to be completely accessible to anyone. So that in the end, there was talk about there being a minibus, but ultimately the decision by the powers that be was to maximise use of the town circular bus.
Okay.
Mara's got his hand up. Peter.
Yeah.
Sorry, yes.
Peter, if I can come in there, because I remember the meeting when the lady from Essex Buildings and Facilities actually said she made that call based on the information that she had presented to her. There is, I believe, Jackie might even remember this, but I do believe there's still, I think it's 15,000 that they promised the town. They promised the town for a transport use that's still in the pot that hasn't been spent. And the town council was contacted just before COVID to say what you want it to be used on, and then COVID got in the way and it went nowhere. Whether that money's been put in escrow or it's disappeared, I do not know, but there was a facility there and we had to come up with a transport use for it. And we were trying to come up with some ideas, so it might be worth at some point seeing if that one still exists.
It does, Mara, because I checked that recently.
Excellent.
With you and Karen, with the lady concerned is Kerry Harding, and she unfortunately has been pulled all over the way trying to provide premises and locations for COVID, etc. But she is still in the loop because she helped with the setup of the vaccination hub in Tyler's Ride. And she does know that that's still on the card. If you'd like to liaise with me about that, I can liaise with her and we can get another discussion going about that. And if the town council's got some ideas about how best to think about using that, that would be very timely.
Bob has his hand up.
Thank you. Bob, you're muted. You're now shaking your head. You're now unmuted.
Yeah, it's polite to mute. Yeah, I'm sorry, John. I've known you for many years and I love you as a doctor. I think bemoaning the fate of pensioners struggling to get up to Crouch Vale Medical Centre when it was one of you and several other surgeries that decided to relocate. I struggle with that one. I'm sorry.
Yes, it was not made clear to us at the outset that everything in the town centre was going to be closed down. And you might say we were very foolish not to write that into the agreement, and I would agree with you if you did. But you know, we were basically GPs doing the day job and trying to fit all this other stuff in and around it. So yes, that was a serious error. We should have ensured that there was something left open in the town centre for the sake of those people who had moved there because of this vision of Essex County Council that there should be a central medical hub with the health clinic and the ambulance station and the brickfields and Greenwood and the dental surgery and the pharmacy, all in this one area, and the accommodation for the elderly around it. So mea culpa, I take my share of the blame, but it didn't become clear until quite late in the day that it was going to work out the way it did.
One thing, a question which has been posed in recent days and asked of us is how is Crouch Vale Medical Centre going to cope with the influx of people from the new development? And the answer to that, as certainly all the councillors who have been on the council for a while will know, Crouch Vale Medical Centre was designed specifically to include that, because they already knew it was coming. And so that is catered for within the present build.
I think the formula was that it was all the rooms in the surgery that were being used at the time plus one. So all the surgeries have what rooms that were used at the time plus one. I'm not sure that it included the surgeries that have been closed, like Raffles practice. And it certainly didn't include the extension to Greenwood surgery that we had at the time when we had 6,000 patients. So it probably is only designed to cater for the number of patients that we had when all the surgeries were open in South Woodham.
No, I can assure you that the calculation was made on the basis of the population as expected when the development is completed.
I think we must agree to differ.
Well, I know that's a fact because I saw it.
Well, I've checked up on it as well, so I think we must agree to differ.
I don't think, all right, okay.
Well, Peter, I mean, apart from the expanding population...
No, moving on, gentlemen, moving on.
Yes, okay. Thank you. Any other comments about, so yes, that covers the provider. So obviously the coming winter pressures is something, and as Dan mentioned, I've started banging on. We're on standby and to continue through the winter, and we're expecting the winter to be quite challenging, or actually very challenging. We know that modelling is going on, but again, we do believe that local input to that is something which will be beneficial all round. So as you heard Dan say, he is doing his best to try and facilitate that. So I think, to be honest, our activities are going to need to continue as they are. There are some new things happening, and so some of you will know that we've got a task force meeting next week to help consider considerations for a new, again, integrated service between health and social care, which is being procured by Essex County Council to start next April. So there are some things going on in terms of development, and we keep on reminding people of the principle of no decision about me without me, and that when new services or existing services are being revised, patient and public engagement should start from the outset. I suspect that we then need to think about what we want with the new ICS arrangement, so we need to follow that, and also think in terms of what the budgets for 22-23 will include, and that's something that we need to be having a say about probably in the first quarter of next year, of 2022. Does anyone have any?
Sorry, Bob has his hand up.
Right, sorry, Bob's got his hand up again.
Sorry, Peter, it's that bloke again. If I can just observe, you guys have been amazing. I was part of it for a while. You've been doing, I think it was, Maura said 15 prescription deliveries on average a day, every day. And I know that some days are busier than others. And I know that you're struggling to get volunteers. It's the same up at the Prince of Wales. All I would observe, I spoke to Rob Walster at the Prince a couple of weeks ago. He actually went onto Facebook and said help. And he got a number of volunteers from going on to Facebook, the South Woodham page, and said, help, we need volunteers to do this. I know that the CVS and various people have got databases all over the place, but they're not delivering. So put your hand up, go out to the people, ask them directly, can you help us? And let's see what sort of a response you can get, because you guys are doing a great job. And I'm sure there are still people that are working from home that can spare an hour in the afternoon to go out and do what they have to do. Just, if you have to think outside the box, this is the time to do it.
Yeah, thank you. The one thing that we have to have for all of ours have to be DBS checked, because we're delivering things like controlled drugs, etc., and sometimes having to go into people's homes. So
Yeah, I know that, Peter, but I actually checked my database and my DBS was never confirmed.
you were, because you were registered with Essex, and they confirmed you for us. All of our existing volunteers have a DBS check, which we have registered in our database, I can assure you.
Well, if you have to do it, but
We
just
do,
don't be afraid to reach out.
No, but I do take your point, and I thank you very much for that. I'm just pointing out that we do have to get our people do have to be DBS checked, where a lot of the volunteering that's been going on, for instance, helping with the vaccinations, etc., they don't need that, so it's a bit simpler.
And Bob, we did reach out to Darren Mills, who was the coordinator for the volunteers at CVMC, and he said he would try and help us to get some of the volunteers from there, because obviously they're no longer doing it there.
That would be cool.
Yeah.
Okay, anyone got anything else they wish to say? Otherwise, I will draw the event to a close. I can't see any more hands up. No, okay, well, thank you all very much indeed for giving up your time. I hope that you will all stay safe and you will exercise personal responsibility and encourage others to do the same, because we are in and heading for deeper waters, it seems to me. And we need to keep our town as free of serious illness as possible. Okay, thank you very much indeed to Nikki for the administration of this, and thank you all for your contributions, and please do feel free to communicate with us all the time. You don't have to wait for a meeting, you know, and we will happily provide whatever information we've got, signpost people, and if you've got questions for people, we will take them up with the due authorities. Thank you all very much. All the very best. Bye for now.